Well, welcome to today's podcast episode where I had the privilege to speak to Mary Fogarty of Solidaritus Healthcare, a healthcare company that is doing things that's quite frankly, it's revolutionary. Now, what this healthcare company is a breath of fresh air that is owned and operated by unions. In this case, what we were talking about are building trades. These are your iron workers, your pipe fitters, your electricians, crane operators, etc., where they have come together to create and to invest in a healthcare model which provides better healthcare to members. How do they do this? Well, they have medical professionals that come together and they have a smaller case or a smaller patient load, if you will, which allows them more time to get to know people. They actually have healthcare metrics, wellness metrics that they need to meet in order from a bonus incentive and structure, not pharmaceuticals, but wellness markers. Very interesting model. There's a few things going forward before we get into this podcast. Number one, I really like the fact that they are thinking outside the box. I am opposed in significant ways to inside the box thinking. After all, there was a lot of people who said this is just how business was done before we had weekends. This is how business is done before we had no child labor. This is how business is done before we have an 8-hour workday, et cetera, et cetera. These were all thought processes and mantras that people would talk about prior to significant changes in the social fabric of our country. This, in my estimation, is the next stepping stone when it comes to thinking outside the box and going, just because it's been done this way this long doesn't mean that it has to continue on. Number two, I find it interesting that it is a talking point that is going to become more rampant, more open, more discussed when it comes to bringing real significant value to people. Number three, it is, in effect, it takes away an anti-union talking point because what we're doing is consistently and continually providing individuals with greater increase in money, where the money goes. So in other words, for the amount of money we're spending in the non-union world as well, there is significant value that has already been brought to the union iron worker, the union pipe fitter, the union electrician, the union tradesman, if you will. This just takes that and augments it, amplifies it significantly because we're giving you even better healthcare. And lastly, what it does, in my estimation, is it puts a pretty nice wrapped up bow on the perspective that indeed unions are at their core nothing more than a collective group of people who come together to negotiate on behalf of them. That's it. It's nothing nefarious. It's nothing disingenuous. We're democratically structured. All of the various propaganda discussions and, mantras and empty rhetoric that is often associated from anti-union advocates and the like. This is just one more weapon, one more arrow in the quiver, one more tool in the toolbox to demonstrate that iron workers, pipe fitters, indeed union craftsmen and women are nothing more than a group of people coming together to provide more and better. I am indebted to Mary for giving me her time to come on this podcast platform and to talk to us about this model here. So without further ado, let's go on into this podcast episode and hear Mary and I talk about healthcare. So, all right. Well, look, I know it's been a little bit of time since we've tried to get each other on the podcast and just have a conversation about what you've got going on. But just go ahead, if you don't mind, and take a few minutes, kind of introduce yourself, how you got into whatever it is, because we're going to explore that, right?
Right.
But just, kind of who you are, what your background is and that kind of thing.
Okay, so I am Mary Fogarty. I am the National Taft-Hartley Liaison for Solidaritus Health. We are an advanced primary care company, which is owned and funded and governed by labor. We have 17 Taft-Hartley funds that invested into Solidaritus as a solution to help save the self-funded unions money in their overall healthcare.
I am this is not the first time. I think I had said this on, I think it was LinkedIn where we got first connected. So it isn't the first time that I've heard about this, but I am really excited to have, somebody who is what I'll say is an expert on this,
Okay.
because I'd like to know how the mechanics work, right? I
Sure.
want to know how it works. What's the catalyst? I mean, I know it was looking to save money, right? But what I'd like to know is, how it works. I'm sure it was because of cost. And then there's a larger conversation that I want to touch on, which is we have a very serious we have an issue in the construction industry, building trades, right? We have an issue with, and I'll say it this way to keep myself off of trouble with YouTube, of people who are no longer here. And for me, I think that industry wide, that if contractors were not just merely paying lip service to what's like cultural movement, or at least a cultural awakening to this, that participating in a greater, let's say, share of providing long-term health care is something that they should seriously consider. So to me, I think that something like this is not just warranted, but this concept or idea of having the individual who just travels around and doesn't have any benefits. People that say that, okay, well, we're concerned with our construction workers. I'm going, I don't believe you are. I think you're just paying lip service to what you're doing. So I'm very interested in the mechanics of this. So if you don't mind, can I, give us a 30,000 foot overview of what's going on?
Sure, sure. Well, Solidaritus itself, the company, came out of a not-for-profit that's based in Washington, D.C., called America's Agenda. The board of America's Agenda is made up of the international presidents of the trade unions, right? Building trades. So what they've been working on for actually the last 20 years are different solutions to the overall health and welfare of the membership. So what has happened is Solidaritas became a company in 2017 out of this company where it was decided that the best way to, number one, a healthier workforce and cost savings to the health and welfare funds would be anchored in advanced primary care. So let me explain what advanced primary care is. And what advanced primary care is, it provides you with an old school doctor, right? We have family practitioners who practice at the top of their license, right? They're from pediatric through adulthood, and they can actually, with this model, have a 30 to 45-minute appointment with an actual person, right? So you have a doctor who's actually getting to know you, getting to know your health, getting to know your family. All of these things become available. Now, what happens as the result of this is, number one, you actually have a doctor who knows you. Number two, you have a healthier workforce because this doctor knows you, you're not walking into an urgent care to some stranger who has no idea who you
Mhm.
are, how you live, where you work, what your family history is like, or any of those things. They're throwing a medication at you. You maybe have 5 to 7 minutes with them after waiting an hour and a half. And the medical condition, if you have, a sinus infection, okay, your sinus infection goes away. But if you have a chronic health condition, that doctor is unable to help you, and you're just going to continue down the path of illness, right? We know, just from what you said in the very beginning, we know that America has sick care, not health care.
Yeah.
And so that's what we've
Yeah.
wanted to turn around. Now, the other piece of this is, who makes all the money in healthcare? Venture capital, private equity, big corporations.
Mm.
Solidaritus is invested in by 17 Taft-Hartley funds. The
Hmm.
shareholders are the pension funds. And no one who is unaligned with labor is permitted to invest in our company. Now, with the growth that Solidaritus has taken, we're looking to go throughout the country, but our beginning focus is Long Island and New York City. And this is going to be something very different. We've created a coalition of the building trades. So our goal this year is 26 centers in 2026 to begin to provide advanced primary care for the Long Island and New York City building trades.
Very interesting. I am going to. So first off, you said that you get a longer time period with your, PCP, which I find that's a fascinating thing because that's typically like, I mean, there were comedians that made jokes about, okay, you go from the larger waiting room to the smaller waiting room to, to being able to speak to somebody for 5 to 7 minutes. So longer time with your PCP. Now, I am curious because you made a comment about sick care, and I think you're right. I really do think you're right. But in the current model that is often perpetuated, primary care physicians or doctors of all walks are incentivized by more patients, more money, more drugs that they shove down your throat. What makes this model attractive to medical professionals, and what keeps them there that is completely opposite, if you will, of what we'll say is conventional medical practice in our country today?
So we are actually being approached as word about Solidaritus has gotten out around the island and around the city by doctors who do not want to be gobbled up by the big hospital systems, right? Now, the things that attract the doctors, let's not forget who we're owned by, labor. What do we pay the doctors? Prevailing wage, right?
Yeah.
So we pay the doctors a prevailing wage. They're also bonused. What are they currently being bonused on? How many referrals they send to the next level of care, to the hospital system, to all of those things. Our doctors are bonused on wellness and compliance to long-term medical care when we have a chronic
Ooh.
disease.
Wellness. There. Okay. So can I
They're
explore that?
bonused on wellness. You know what? Gosh, we should have like had my presentation deck up here because I
Uh,
can show you the actual doctor's report card that they need to meet a certain level. And I mean, these levels are like 89% adherence to X, this decrease in diabetes complications, this, you know, medical plan was followed and this person lost X amount of pounds with their heart disease, and this person adhered to their kidney wellness. So, all of those things are what our doctors get bonused on.
so this is so fascinating. All right. So when you let's say either when you approach a primary care physician or they hear through the grapevine, as you said, and they come to you and they say, look, we're not really interested in partaking of what's, kind of like morphing into even worse than this is not the route that we want to go.
Right. This
Um,
is not why we became doctors.
right. So you're experiencing that. Okay. So there's a lot of questions I've got, but what is the age of those individuals, if you don't mind? Is it all over? What's the average age?
Of our physicians,
Yes. Yes.
yeah, I would say it's probably a little bit more mature. It's probably, somewhere between 40 and 50 that, want to come on board.
Okay.
The other piece that they love, so we're not fee for service. We don't bill the insurance companies. Okay. So our doctors have no larger a caseload than between 9 and 1,300 patients, as opposed to thousands that they have now, which is why they need that 7-minute appointment, because they
Right.
need to bill the insurance company for this and that and this and that and that and this. So when the member comes in, there's no copay, and we pass on our wholesale savings to the fund on the first 50 to 130 most prescribed drugs, which are also in-house, which the patient leaves with that day. and we pass on the savings to the labs that we get at wholesale. So we make no money on the wholesale of the pharmacy or the labs. In addition, we have a belly button fee, right? As opposed to a doorbell fee, right? So it's not per member, it's per person insured. And we've been able to reduce that cost as well because of the coalition. So the sheer numbers of members that want to participate in this and the number of the building trades unions that want to participate have made it so that everyone's getting the same savings, whether you have 40,000 members or you have 300 members in your local.
This is very fascinating to me. I think one of the so my mind automatically goes. There's so many questions, but my mind automatically goes to usually one of the, let's say, one of the talking points about anti-union is that they say, well, you don't have any choice, and it's always this, younger people are subsidizing older people, and I'm like, first off, you don't know what you're talking about.
Right.
2/3 of all bankruptcies in this country are due to medical debt, and 2/3 of those are individuals or families that had health insurance that had to claim bankruptcy. So this model is a fascinating thing, and I think that it is. I think as it's going to continue, I can't see a situation where it won't continue to grow. It doesn't make any sense to me. It seems to me like it's a model that actual healthcare professionals that want to, let's say, provide a standard of care, that's why they got into the business in the first place, right? Between them and individuals, collectively come together and say, hey, look, we want better, healthcare coverage for our money. I can't see where it's not going to grow. Do you find that there are individuals, whether it's at the insurance level or not, that have a bone to pick with this because it cuts them out or it takes away an arguing point against unions, for example?
Well, so it does. It can definitely be used as an organizing tool, right? So the other piece that we're finding the funds really like, they don't have to have a plan design change. This does not replace their current carrier. They can keep their Blue Cross, their MagnaCare, their Aetna, their Cigna, whatever of, the major insurance carriers they have. This is in addition to that. So we're saving money for the fund, but they're having no plan design change. So it's an easy lift for the members. The members get their VIP membership card to Solidaritus. The way we are constructing the coalition and the geography that we all live in, right? You're on the East Coast, so you understand the geography here, and especially on Long Island. You may be working in the city
Yeah.
and live out in Suffolk County, right? So if you're not feeling well, or let's say the family's traveling and somebody isn't feeling well, you can go to any Solidaritus. But the one that you primarily will go to is the one closest to your home or closest to your job, whatever is going to be found to be the most convenient for you, which is why we need so many centers around, right?
Right.
The pushback that we've received was initially, um, hey, this is going to cost us money at the hospital level, those kind of things. Probably in the long run, it will. But do you want a healthier population? You're a hospital. What are you trying to do? Keep people sick? Get them well. What are you trying to do? You want to serve the union who you have as a customer, or you want to cost them money,
Yeah.
right?
Yeah. Well,
So
it makes sense.
they can push back, but what are they going to say? And and I will say this, we're not the only advanced primary care company in the world, obviously, and in the country, and even in the region, but we are the only one owned, built, and governed by labor. All of our construction has a PLA on it, of course.
Yep.
We're governed by labor. There have been attempts to purchase our company by private equity, and the board has said, no, thank
Has
you.
there really? I I'm not surprised.
Right, of
Um,
course.
I'm not surprised. What do you think the reason is?
They know They know that they're losing money. They're losing money. So someone's making the money. What does labor want to say about that? Do they want to keep it in their own health and welfare fund? Do they, instead of having a double-digit increase next year, let's say they have a new contract and they have a $7 increase over the next 3 years, right? It gets it gets it gets negotiated, all of those things. Do they want to keep that money in the member's pocket?
Yeah.
Do they want to put it into organizing? Do they want to put it into the target fund? Do they want to increase the pension for, the apprentices? Do they want to put it into whatever they want to put it into? How about you just put it back in the member's pocket? How about the
Right.
member gets a $7 increase over the
Yeah.
next 3 years?
Right. Based
Rather
up.
than having to announce at the union meeting, hey, we negotiated a new contract and you're still going to have benefits, but we had to increase your copay and we had to do this, and you're not actually getting, that $5 that we fought for the last 3 months at meetings for.
It's very interesting. Yeah. So I could certainly see where private equity wants to purchase this model because they want to bury it.
They want to bury it.
Yeah.
They want to get rid of it, or they want to suck all the value out of it
Yeah.
until you have a medical assist, until you have the same exact model that's happening now. So the other way that they came to this is over 80% of all ER visits could have and should have been handled in an advanced primary care setting. So people are going to and accessing ERs at a major cost to the fund when it could have been handled in an advanced primary care setting. Could they have gotten an appointment? Were they not told when they called that, yeah, sure, I can see your kid, but it's going to be 40 days from now? All of those things.
Ah.
So the ER visits, 72% of all urgent care could have and should have been handled in an advanced primary care. So the urgent cares kind of cut the costs a little bit, but what did the hospital systems realize the urgent cares are? Great feeders for the hospital system. Go
Yeah.
here for your x-ray, go here for you need this, you need that. So all of those things. So we're not saying obviously that if someone comes into an advanced primary care and they need further services, but what we'll do is our care managers will be sure that we're sending them to the best care possible within that local's carrier's network.
Fascinating. It's no, it's I'm thinking about the model and I'm thinking about all, like from the opposition that would come from private equity where, they have investments elsewhere. So I want to buy this up so I can bury it because I can't have this model, let's say, metastasizing and growing into, which is what's going to happen. Correct.
Of course, yeah, that's
It's
our
going to,
goal.
yeah,
That's
it's going
actually going to be my new title. I'm going to be VP of Growth and Partner Success. So,
yeah.
yes, it's
Yeah. So
going to grow.
you got your work cut out for you, right?
Yes.
Yeah. So when you brought up something earlier where it was like, okay, well, how many was it 75% or 80% of ER visits could have
Yeah.
been handled?
Yeah.
Yeah. So but it makes it, if we're so used to, let's say, for 2 decades, at least 15 years, maybe 2 decades, if we're so used to not being able to get a hold of our PCP first off, we don't even have a real like established relationship with that individual.
Right.
And then if I'm having to schedule my appointments out 6 months because the volume of work is so much, then it doesn't even enter in my mind to I've got an issue that I need to call my PCP. I'm just going to the emergency room, right?
Right.
Because that's what it's quote unquote there for when I could probably get better care from the advanced care person, part of my PCP. But guess what? I'm so ingrained in the concept that I'm not going to be able to talk to this person because they're so busy. They got 10 times the patients that, Solidaritus is talking about doing, that it just makes a lot of sense to me when I
Well, let's also look at it from a member's perspective. Okay. Right now, sometimes their hourly rate that's going toward their health and welfare is more than minimum wage. So now you think about this. This member has worked however many years, hours, all of those things. They have a family. They have a card in their pocket that says, I earned this. I can go wherever I want. Okay, so follow this here. I can go wherever I want, and they treat it like a black Amex, right? I can go to this hospital, I can go to that hospital, I can go to this doctor, I can go to that doctor,
Yeah.
not realizing the cost to the fund on that and
Right.
the cost that it's actually still costing that member out of their pocket.
Right.
Now, we give them a Solidaritus card that actually is giving them value, care, all of those things that they have more than earned, right? Labor negotiates the best medical care possible for their membership.
I agree with you.
And they're still, the middle class is still paying for everyone's care. Ours, those who can't afford it, which I haven't heard anyone say they're unhappy about, taking care of someone, right? We are labor, so everyone's pretty generous. And the wealthy, this is care that before the advanced primary care, only the wealthy could have. 24/7 access to your doctor and your medical professional by phone. So let's say in the middle of the night, one of the kids wakes up, they're sick, they're not feeling good, it's freezing cold like it is right now here in New York. And you don't really want to drag them out at 3 o'clock in the morning and go sit in the emergency room for the next 4 hours with sick people, right? With other sick people. You get 24/7 access to your doctor. You call them, there's a video or a phone call or whatever it might be. The doctor says, you know what? Hate to say this, you're going to have to go. Or, you know what? Sounds like this. I'm going to get your prescription ready. You can come to your Solidaritus in the morning and pick it up.
Do you? So I want to touch on something that you just got done saying, which is
Hmm.
union negotiated healthcare benefits. I have said this probably for at least the past 15 years. I've been in 2024 now. Um, when you first get in, you don't pay any attention because you're young.
Right.
But um, even the young still need health insurance, by the way. But I have said this over and over and over and over again. One of the significant benefits of being a union member and likewise being a union contractor for your employees, if you actually even care about them, is that the healthcare for the money that is spent from the union perspective, the money that is spent creates significant benefits healthcare wise. Companies like management and all that kind of stuff, they'll spend more money for healthcare and they get less for it. Union
Yes.
union negotiated healthcare is one of the most significant benefits that you could have. And it blows my mind. This is why I was saying earlier in the podcast, the the companies that say things like, well, we're taking, this epidemic. I'll use the word epidemic. This epidemic of people no longer here. We're taking this seriously, and and companies are saying, okay, well, this thing with healthcare puts a strain on our employees. Okay, well, I got a super easy solution for you. Sign a contract, become part of the collective bargaining agreement. You get a lot of benefits that you just don't know about for the most part. I'm not going to really reach an anti-union individual, but someone who doesn't know, which what I believe is predominantly most of the people, they don't understand the significant benefits that they get by being, union members and uh, contractors get by being union signatory contractors as well. And one of them is, of course, the fact that we get union negotiated healthcare that is I can't think you attribute it to being like the wealthy. You could only get this kind of care if you are wealthy, and I
Yes.
think you're probably right. I think that's probably akin to that, actually.
Yes. And, just to go back to what you're saying about the younger population and the apprentices and all of that, our goal at Solidaritus is to get them engaged, get them in, make sure you're caring for your health as you get older, as you are doing this, heavy physical labor, keep you well nourished, keep your sleep in order. We can talk about, of course, a lot of the people that are no longer here. My background with the trades began with behavioral health.
Did
So
it?
I did some marketing for treatment center. From there, moved into members assistance with some of the iron workers. I did education and training, drug testing, all of those things. And, part of the wellness, and, in the very beginning, the apprentices would look at me like, okay, lady, but things like, okay, let's talk about how you're sleeping. Let's
Mm.
talk about, have you ever tried yoga? Let's talk about, do you know, I know, that's exactly what they did. Do you know that? And then I tell them, listen, I come from a family of iron workers. I have watched what happens. I
Yeah.
watched my father retire and no longer be able to move, right? All of those things. So my son had a severe injury. He ended up saving two people's lives as the result, but he grabbed a bundle of rebar that was sliding and was going to kill two people standing below, right? But he had a
Mm.
severe injury, a life-changing injury. Um, so all of those things, right? Do you know that in your benefit, and this was one specific union, right? In their benefit, they had a bi-weekly medical massage benefit. They could go to, a physical therapist or somewhere and free, no copay, nothing, and
Yeah.
get an actual medical massage. So all of those things, just making people aware of what's available to them. Knowing that your family is going to be well cared for, knowing that we're going to do our best to make sure that you don't develop diabetes or heart disease or any of those other things. So that's also the focus of Solidaritus, which is really turning healthcare around to a more healthy population.
No, it's fine. Yeah, I could only understand. I mean, I'm an apprenticeship instructor. When we're done with this
Oh,
podcast, I got to pack stuff up. I've been an apprentice instructor for probably 18 years now, give or take. And when we're done, I'll pack my bags. I'll drive a couple hours and I'll be there all weekend. And I'll teach apprentices. And I'm always talking about their benefits because not that you already know this, but because their benefits are on top of the check, a lot of guys just completely forget that they get those. I'm like, whoa, 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 whoa. Let's talk about all of the benefits that
yes.
you get. And, uh, insurance, healthcare is what I'll say. Healthcare is something that I think we just when we're young we take it for granted, but it's like I wouldn't. You just talked about your son and a bundle of rebar, and this is the thing that really gets me. And I'm not, there are individuals who don't go out in the field, and so they have this perspective that, oh well, young people don't need health insurance. I'm like, you don't know what you're talking about. That just sounds like a wonderful packaged up piece of propaganda. If you don't know what you're, and people get swept up with it all the time, and it's very frustrating because when you work in a trade, it doesn't matter which trade it is. When you work in a trade, it's very physical, it's very demanding, and there's a lot to say about needing let's say the continual healthcare coverage or balance or however you want to phrase that is so valuable. And this is also true, um, especially when you're young and you're starting out a family.
Yeah. Of course. You need maternity care. You need
Yeah,
all of those things. You need all of those things. And so coming back to the apprentices and the injuries that they sustain, I also spoke a lot about alternatives to pain medication, right? Because we have the opioid epidemic.
yeah,
And they absolutely positively, let's just talk about the facts, right? We have a higher incidence of alcohol and drug dependence in the
yeah,
trades,
yeah.
right?
We do. Yeah,
It's absolutely, as well as unfortunately. So in the advanced primary care, we have integrated a behavioral health assessment at your initial consultation with your doctor. Let's talk about this. And we are integrating a value-based, which just came out of DC, and a value-based network of providers for both mental health and substance use. So we really truly are considering the entire person and how that looks as far as your overall health. People have no understanding, like you talk about the apprentices not understanding their benefits, their vacation, their annuity, their pensions, all of those things, right?
Yeah.
In this, right, people don't ever think about all the cancers, all the let's face it, right? If you're thinking about your kid who's having a mental health issue and you're however many stories up, God forbid an accident happens because your head is not where your feet are right now,
That's right.
right?
That's right.
Because you're thinking about something else. How am I going to manage this? So we're going to have care managers that are going to be available to the families and be able to help them in these situations should they come up. We don't want them to come up, but guess what? They come up. It's a reality. And we have the highest incidence of it.
Yeah, you're absolutely right. There was something you said earlier was considering the whole person. There's there's this there's this let's say there's this idea that we're going to compartmentalize work. What takes place at work is not going to affect you at home, and vice versa. And business seems to love to do this, like as if to say, well, whatever you've got going on personally doesn't matter, or to flip the coin, whatever we're doing at work isn't going to affect you at home. And I'm going, that's not true at all.
No,
That's what a crock of crap.
no.
It's a way for you to shove off any form of responsibility onto the individual. But when we consider the whole person is, and a large part of who we are is what we do for a living, who we do it for, who we do it around. And so this idea that you just brought up, which was considering the whole person, is absolutely spot on.
Yeah.
It's
And we
absolutely spot
we
on.
we need to we need to build a healthier membership, a more aware membership. This generation coming up has been through something that none of us lived through, right? As young people, the pandemic that everyone lived through. I mean, lives were changed forever
Hmm.
in
Yeah.
regard to this.
Yeah.
People lost people, number one, right? People lost people.
Yeah.
Number two, people couldn't go to work. People couldn't make a living. Personally, it was the first time in my life I was ever on unemployment. I mean, so all of these changes that happen, these are the people that are now coming up through the apprenticeship. So they've had a very different, you know, uh, coming of age basically than those of us who are a little bit older had. And so there are so many things.
Yeah. So let me ask you, out of the different, because you brought up the youth, out of the age brackets that you probably communicate with about this particular model, is it an accurate assessment that the youth seem to be more open to it as opposed to some of the older folks? I know doctors are the flip, right? But is it the case with younger people being more open than older people?
So I think that it's going to be able to come back around, and that as we're able to reach out to the apprentices, they're not set in their ways yet,
Yeah.
right? They're
Yeah.
not. They're not set in their ways yet.
Yeah.
Do they have that hey, nothing's ever going to happen to me. I'm
Uh,
25 and buff, you
bulletproof.
know?
Yeah.
Yes, they do, right? They don't think in those terms. But the way we're going to reach them is different than the way
Yeah.
we're going to reach the older, ready to retire part of the membership, right? So
Yeah.
we have social media engagement. They're going to have a card in their pocket. They're probably going to have something that they can keep right on their phone to make their appointment. They're going to be able to reach their doctor on their phone, face to face. All of those things are happening. So I believe that engaging them will be a little bit easier, as well as traditionally, right? Mom is somebody staying home with the kids, right? I don't want to get either one of us in trouble by saying it's going to be mom. But let's face it, right? And just the power to be able to reach out to the parent that's home with the kids or responsible for making the appointments for the kids and all of those things. All of those things are what we're going to engage in. So We need to engage the older population. That's going to be a little bit different. We're going to come to union meetings. There's going to be mailings. There's going to be emails, all of those things to get them engaged. Because let's face it, right? We know that 80% of the spend that the Health and Welfare Fund faces is spent on 20% of the population.
Hmm.
So that's traditionally going to be the older population, unless, of course, you have a preemie or God forbid someone gets cancer at a young age, some of those things. But it's going to be the older population usually that's going to need the most medical care, right? So we need to be able to focus on both ends of that spectrum and be able to reach everyone. So um, traditionally in Solidaritus, they have found that those who have the most medical need are usually the first ones engaged. But my theory is that we're going to be able to reach the apprentices, right? We're going to
Yeah.
talk to the apprentice coordinators and say, hey, you know what? Let us come in and speak to your apprentices about their healthcare, about the options that they have, about their wellness, about yoga classes, things like that. Want to know what? I got some of the younger iron workers. I brought a yoga instructor in.
Did you really?
I did. I did. And she was local to the apprentice hall, and this was several years ago, but she made it possible. Like, she worked around their schedules and like threw in a couple of classes, and some of them took advantage of it, and they were like, guess what, man, my back feels better, like
Yeah.
all of those things. So you never know what's going to reach them. I feel like the younger generation is a little bit more open-minded to things like that, where someone from my dad's generation or even your generation, were like, what? Nothing. No, I'm fine. Give me a
Yeah.
beer.
Yeah, I
So,
think yeah, I think you're right, and it reminds me of that meme, like 80% or whatever it is of a lot of incidents or older men thinking they're younger men or whatever. Give me that beer, and I'm good, I'm good. It's like maybe you're not good, and
right.
you know uh,
Exactly.
take
Exactly.
advantage of checking in with your advanced care
Yeah.
physician. So yeah,
And
it's an intriguing
and
model.
even though there's been such movement of females being available and having the trades available to them as well as apprentices, it's still a male-dominated world. And so we do need to figure out who's at home that's going to be pushing where you're going to the doctor, right?
Mm.
Like, most people's wives are going to say, honey, you have an appointment here, here, and here. Here you go. Go. And he's going to say, okay, thank you, or whatever. Or no, I'm not doing that. I don't need that, blah, blah, blah. But that's where we need to focus the engagement on is, and each group is going to be a little bit different,
Right.
right? Each of the trades are different. Well, we know the trades are different, right? So, depending on, we're going to meet people where they're at is, in short, what our marketing tool is and marketing plan. But one of my favorite things, and it kind of goes back. I told the story when I first joined the company at one of the building trades conferences, and so my father was in 580, and my uncles were in 580, and my family's all from Yorkville, up on the Upper East Side in Manhattan. So I lived out east. My father commuted and gave us a life to grow up in the country. My father commuted to the city from the Eastern Long Island all the time,
How long was
working
that
in the trade.
drive?
2 hours each way.
Yeah, but there's something about country living sometimes. You know what I
Yeah.
mean?
So I was blessed to be able to grow up out there. So all that being said, my grandparents still lived in Yorkville. So my daughter, who's now a grown woman with her own children, but she was in the back seat. I'm driving in to pick my grandparents up, right? Because they didn't drive. Um, and my daughter looked out when we were going over the Triborough Bridge, and she looked out of the car. She was little, like maybe 3, and she goes, is that the kingdom Poppy built? Because it was just dusk, and all the lights came up in the city. And the other piece about Solidaritus is that because there's a PLA on every project, as they're being built and
Yeah,
as, different members of the trades are working on them, they're driving by there going, I built that, I built
that's right.
that. I was on that
That's right.
job. I built
That's right.
that. That's
That's
mine.
right.
And then it's going to be, hey, you know what? To their friends, my dad built that. Or that's the place where we go to the doctor because my dad built it. All those things are going to, or my mom. Here again, I don't
Right.
want to get us in trouble. Um, all of those things. So it's also that pride of true ownership. So it's built by, it's governed by, and it's owned by labor.
I love it. I I love it, and I've been sitting here thinking about this for a little bit now. Do you do you know of any potential political opposition to this? And I'll tell you why I have this in my mind. Back during so before the Great Recession of 2008. So a lot of people don't know this, but the federal government actually had a substantial amount. They had a large part to play in why that took place. So when it come to pension plans, they had two older rules in play that they're both since gone now. Um, but what they said was, we don't want large pension plans, which a lot of your building trades pension plans, or some of our plans are relatively small in comparison. But they said we don't want these plans to be swaying the market, which is exactly what is taking place with the model that you're talking about. So what they did was they said you can't have a pension plan more than 100% funded. If the actuarial numbers and the data all come together and it said your plan was over 100% funded, you either A, had to give the contractor money back, or you had to raise the allocation that you paid to retirees. At the same time, they had a rule that you could not have more than 25% of your total package going to retirement funds. So if you had an annuity fund
Okay. Hmm.
and you had a pension fund and your total package was 25%, but one of those funds needed money, you couldn't give it to them because you were henpecked, if you will, by the way the federal government run. Long story short, the very thing that the government did said that they did not want happen, which was the pension funds to have undue sway in the market, did exactly that by the rules that the federal government had in place. So I'm genuinely curious if there's any political opposition to this, because there always seems we're political in every single thing we do. It seems like.
So my understanding from the labor leaders that have the relationships with the politicians locally is that in a bipartisan view, no one is opposed to this. Everyone thinks this is a very good idea. And I'm hoping that even the latest news out of Washington, geared toward better healthcare, better health, all of
Right.
those things, that there won't be opposition in that as well. And then to go to your point of how much of the the paycheck can be put toward different things, this can be used in any way, like we talked about in the very beginning, right? You can put it toward your target fund, you can put it toward your organizing fund, you
Yeah.
can put it back,
Yeah.
heaven forbid, right, back in the members' pockets.
Right.
Any of those things it can be used for. And my understanding is that it's no different than any other investment that the pension funds invest in, as long as obviously it's not 100%, but I don't imagine anyone would put 100% of their money in anything. So um it would be, just part of their portfolio, but they would have the say over where the profits go.
Well, what it sounds like to me too is that maybe, hopefully anyway, maybe some politicians have learned from previous politicians' mistakes. I would hope anyway. I think it's a fascinating market, and I would say that expansion plans are not only being discussed, but what's the what's the perception of rolling this out, outside of the major metropolitan areas to, I don't want to say rule, but you get what I mean. Like
Sure.
outside of
Well,
the major hubs of Chicago and New York and LA to, like, the Baltimore, D.C. and the Atlanta, and you know what I mean.
So our goal is to spread throughout the nation. So we have a governing board, which is called Building Health. So at present, the chairman of that board is Matty Arasich, and he is the president of the Long Island Building Trades. So we are governed by the business managers from our region, right? If they want to be on the board, they're welcome to be on the board. Nobody's paid to be on the board, so there's no conflicts of interest. I just want to put that out there, okay? No one's being paid to direct this. Um, and our goal is to spread it throughout the country, right? To all the unions and to begin with the building trades, but then to move into public sector, possibly into like the volunteer fire departments, those kind of things. Right now, Solidaritus is in some rural areas. I mean, it's in Oklahoma. It's in some parts of California where there are definitely some care deserts. As a matter of fact, Philadelphia Building Trades is on their way out to tour one of the facilities at the end of this month. I'm going with them. And they have a care desert right now, right in one of their regions. So they're looking to put up 6 centers right where they are to help alleviate some of that care desert that their members are facing.
Yeah,
So
fascinating.
so that's and that's a long answer to your question, but yes, we're focusing on this corridor here because we know, right, the Northeast and the trades, we're going to be able to have a lot of power in a movement to be able to spread this out across the country.
As you have, let's say, discussed this more and pretty much just gotten the word out, have you seen? Because you made a comment earlier that it could be used as an organizing tool, and that's where my mind goes. Have you made any believers out of non-believers, and
So
seen anybody interested in this?
one of the ways that they're using it as an organizing tool, as we know, right, your benefits are connected to the hours that you work. And right now, we have lots of hours, we have lots of work, we have almost full employment in most of the trades around here. But listen, I was an ironworkers kid in the early 70s, and it wasn't always like that, right? There was a lot of
Yeah.
time where there wasn't. The fund can decide to pay that belly button fee even if someone doesn't have their full benefits, so that at least you get your primary care, you get your prescription if you need it, your kid can have an ear infection and be taken care of with no out of pocket to you. So there's many ways that it can help to organize in that way as far as what can become available to you. In addition, um, there are some contractors that are signatory that are thinking of bringing their employees on the employer side into the union so that they can have these benefits too, because the benefits are better.
Ah, see now,
No.
right there. That's it right there. To me, I think that's a significant benefit. You want good health care. You want to take care of your
Yes.
people. You want to take care of your employees, your human assets, right? That help you be able to do everything that you're doing. This is one of them right here.
Yeah.
That's a wonderful. This is what I think.
So there's participation agreements that are actually being, kind of thrown around and to some of them and to the employer's benefit, they're like, yeah, let's do it. Let's make this work. They're a great union signatory contractor, but that word is getting out as well.
Yeah, I would suspect that there's going to be a lot more of that as this model. You're going to save me money. Um, the member, you're going to save me money while expanding the quality of healthcare. Oh, hey, by the way, contractor, if you're taking care of your guys and ladies, this is where you want to come on in at. Oh, by the way, your employees that are management can also participate. However they, however we, kind of navigate through that whole system and setup. I think that's fascinating, and I think that is it takes away an anti-union talking point.
Yeah.
Um, which a lot of those are just mere propaganda anyway. And
Of
then it
course.
really addresses the truth that, hey, look, the unions are not this nefarious. This is going to be one of those shorts that I'm going to share. Unions are not this nefarious big organization that just wants your money. It's a group of collective people coming together to bargain for better. And in this case, they're bargaining for better health care. And how do y'all doing that? Because we're coming together to, guess what, to form this company that we're bringing in medical professionals who want to actively participate. I
Yeah.
find it fascinating that they hear, I'm not even sure how, and maybe you can help me. I'm not sure how they hear about this, but they do. And then they reach out to you going, how do I get on board?
It might be the hospital system saying, and then the doctor going, oh yeah? I'm calling them
Yeah.
because I'm sick of you guys
Yeah.
making me work like a dog for your
Yeah.
profits,
And I'm
right?
not even, and I don't even get to like really, some people probably are interested in this model because they have a better bedside manner, they have a more personable one, and they
Hmm.
actually want to administer and get to know whoever they happen to be, providing healthcare on and to. So I think it's a fascinating model. So do you guys do any follow-ups with your healthcare professionals once they come on board? Like, okay,
Oh,
you've been
sure.
doing this 6 months, a year. Give us some feedback on how we can be better. What do you like? What do you not like? What are you hearing slash seeing?
So, our medical director is actually a naval veteran. And so he is really so focused on the the happiness of the doctors, the wellness of the company, the wellness of the patients, obviously, but the overall care that's administered. I mean, so we can talk about this, right? You walk into a Solidaritus, and I know the women kind of get this a little bit more sometimes than the guys, but it's not quite a Medi Spa, but it's definitely it's definitely not your run of the mill, plastic chair, urgent care.
Really?
In the first place, there's no one else in the waiting room. This is your appointment, right? So you're not packed into a waiting room with a bunch of other people. There's refreshments available. There's your receptionist that's going to meet you. Your doctor may be waiting for you. That's the goal, right? Is that your doctor's actually waiting for you to welcome you and bring you in. But it's a very comfortable setting. They use a lot of psychology in the when they're building out the center, when they're decorating it. There's a lot of psychology used so that you feel good and you feel welcomed and you feel comfortable. The
Yeah.
colors, the construction itself, the layout, I'm sure there's a little feng shui in there, like, so that you feel good when you walk in. All of those things in the actual exam rooms themselves, right? Obviously there's everything you need in an exam room. However, there's also a large screen TV. There's a seating area that, if you're having some sort of an issue where you require, some longer term care or anything like that, or maybe a specialist, right? If you need a specialist, but your primary care is coordinating all that, they can bring the specialist right in on the screen. Your spouse can be there, your significant other can be there, both parents, if God forbid it's a child that's having an issue, both parents can be there with your specialist, with your doctor, all of those things like that you're not getting anywhere else. Usually someone's sitting behind a screen going like this, taking your information, right?
Yeah.
And and
Yeah.
and and making your prescription go over to the local CVS or Walgreens or, whatever. So all of those things are there as well. So it's a very, very inviting space to come into, in addition to my dad built that, right?
Yeah.
So you
Yeah. Oh
have
yeah.
you have all of those things, right?
Yeah.
All in one. And that's what separates it as well. You have a place and an environment that doctors want to be happy in. And to answer your question, yeah, of course, we want the doctors to be satisfied, and that's on our medical director. In addition to that, we do have a lot of veterans in our company. Our VP of Ops is also Special Forces veteran. So um, we have a lot of very, how can I say it, like deeply caring people who really want to make a change and make a difference, right? If you've devoted yourself to the country, I feel like you've devoted yourself to people, right? If you write a check for your life for the rest of your life um, to a country, I'm pretty sure you can, you know, be really good to have a part of a company like this that's people focused and member focused.
Yeah. Well, the really interesting, I mean, there's so much that's interesting about it, but as I sit and think about it, if it comes from a member or it comes from a doctor or whatever, because this is, let's say, unconventional, right? It's unconventional. It's outside of the box that healthcare insurance companies have built, private equity, however you want to term it. Um, you're more than likely and more willing to make any necessary adjustments when it comes to increasing the well care of the patient, as opposed to it's all about the bottom dollar, right?
Yes,
And
right.
that I find interesting, and I suspect that over the course of how this thing evolves, there's probably going to be numerous stories, and this is from a marketing perspective. There's probably going to be numerous stories of Solidaritas going, hey, look, this doctor saw a hole in care for whatever reason, just making
Yeah.
up, right? We saw an increase, a tick in mental health concerns in this area or whatever. So they recommended that we do this, and then we adopted that. And guess what? This is not something that you have to pass the smell test on through an insurance company because they're bottom dollar focus. We're focused on members here, and the change was significantly easy. It was just as a matter of a doctor or a couple of patients bringing it up, and next thing you know, bit bam boom, we're providing this next level of care, however it turns, whatever it looks like.
In the behavioral health world, of course, I'm sure you're aware, being in the trades for this long, many times there's denials of the care that people need, right?
Yeah.
From
Oh yeah. Yeah.
Solidaritus, you are having an MD make a referral. You're not having someone from the local, you're not having someone from a members assistance program. All of those things are great, right? You're not having someone from an EAP, and those things do work. But here you have a doctor who's saying this person needs X, Y, and Z, and we can't manage it here, and you have to manage it there, right? So that brings me to, our network that we also build of preferred providers that either do direct contracting with a fund, or we've vetted them, and they're in network with whatever the carrier is, and we've done a study on their outcomes. But it makes a huge difference when you have a doctor making a referral to behavioral health next level of care.
Yeah. 100%, right? Because I'm going to make the referral because I know who you are. I know you as a patient. I'm not
Yes.
overloaded and I'm getting like 7 minutes max with you. I'm just going and pushing you out the door and saying, "Yep, you're good. Everything seems great. Here's a prescription for a pill. Get it out of my face."
Exactly.
So,
Exactly. Yeah. And that's also really super important too, because as you may or may not know, right, Helmets to Hard Hats does an amazing job
yeah.
of
Oh, yeah.
placing veterans, right? But
Yeah.
many times those veterans have fallen through the cracks, through the VA, through the military, through whatever it might be, and so
Yeah.
we know the level of veterans. We know the level of veteran um, substance use disorders. Having been fed pills, here you go, you'll be okay. Um, and so there's one more way that we can help support that person as they're coming back into civilian life and as they're coming back into the workforce in the United States, and just be one more thing to give them that extra support that could be there for them in the trades.
Yeah, no, that's 100%. I think, I live in an area where we have the highest concentration of military anywhere in the country, right? So I'm constantly surrounded by military, so that makes perfect sense to me. But on that, kind of like a segue into that, when you start talking about military and just the trades in general, right? The trades have a a rate of uh, losing people that's 4 times higher than the general population. And as trades go, iron workers have the highest. If is there maybe it's if and then is there a I know we're talking about an MD, um, but in the long term calculus of offering care, when we start talking about mental health, um, is there in the works, or is there already somebody that, like, it's not just an MD that's there, but it's also someone that can, like a, I don't want to say a psychiatrist, but you get what
A
I'm saying.
PNP, like a
Yeah,
psychiatric nurse
yeah,
practitioner. So
somebody that can, yeah,
those are absolutely all connections that we're going to be making, whether there's
okay,
one on site, whether there's one, but that would all be part of our network as far as the behavioral health goes, and to be able to do those assessments and to be able to refer to someone immediately, to would most likely be a psychiatric nurse practitioner.
okay,
That would be, within the practices, that would probably be the most effective plus cost effective
right,
for
right.
the funds, and to have those people be available.
Yeah, 100%. There's a balance in that we have to we have to make there, right? And that makes sense to me because I start thinking about, because quite frankly, um, we've made, at least in my estimation, we've made a significant amount of progress in addressing to some degree the stigma that's associated with it. You saw it automatically say your mental health. You're like, what are you, weak or something to that effect? But if your knee is jacked up or your back is jacked up, where do you go? You go see somebody that can help you. Sometimes there are things that really get us down. Some of it could be work related, some of it's not. And, quite frankly, sometimes talking to somebody that is not in your inner circle might be the thing that allows somebody, that gives them that strength to, let's say, carry on, and to not do what unfortunately has been done, quite so heavily in our industry in the past. Well, it's been a long time actually. I'm kind of a cynical person. I think that the only real reason, significantly, that this is getting any real traction is because of the labor shortage.
Yeah,
I, it.
it could be. It could be.
Yeah.
From the members assistant standpoint, so I went out to Impact a couple times, and did some presentations. I met with I won't say his name, but the head of a couple of different ironworker associations. And from my standpoint, right, and coming from a family of iron workers, and a family of addicted iron workers, right? So we have a lot of addiction in our family, but we also have a huge, like, now if I add it all up, hundreds of years of recovery in the family as well,
Mm.
right? So that's where my background comes from. I felt as though there was in the leadership a true concern. It was also, though, hey, we're iron workers. Like, we're not doctors, we're not psychiatrists, all of those things. So reaching out to those who could be of help. Um, it could be because of the labor shortage, but my own personal experience with the leadership in the trades, and especially with the iron workers, was that there was a true caring, like, hey, what's happening here? It's not about like let's just go to the bar at lunch, and deal with whatever anybody might have on their head. But let's see how we can do this. And not only that, but let's talk about, like, with market share, right? Like, you're fighting for jobs, you're fighting for market share. You don't want people failing random drug tests on the job and then say, "See, we gave it to union, and this is what happened." So I believe there was some of that as well, like raising that awareness. And then, just what happens in the trades, right? And the iron workers are at the top of that scale. And I don't know why you would think, coming from a whole family of them, and being sober myself, I might know, but I don't know. I don't
Well,
know.
the
It
so
was
so
just it was just home, like,
100, yeah, and I mean, when I first, so it bears. I need to make sure I'm very clear on this. I am, when I say that, I'm not being cynical towards, let's say, union contractors because
Yeah.
they've already thrown in their lot
Yeah.
with taking care of members because they're union. But you brought up market share and a significant
I'm
number
talking
of
more about
work.
the developers themselves. Like,
Yeah, I'm talking. Yeah, I'm talking about like a lot of non-union
I'm talking about
contractors
like these guys here,
way up here. Yeah, so
Yeah.
I'm talking about the ones that will be interviewed. I was doing some research, and that it was there was a guy who had who was no longer with us on this earth, and the contractor in general, which was down south, and they were talking about, oh well, the healthcare issue and the squeeze on workers because they may have to travel for work, and it was like the seasonal nature or whatever they said, and then it was something along the lines of about healthcare and how there's sometimes where they're without healthcare, and I'm thinking, well, to me, if you ask me, then what you're really illustrating is the fact that if you like, there's a reason we have banked hours so that
Yeah.
if I take a layoff for whatever reason from my contractor because work's got slow, guess what I still have? I still have health insurance. And if you
Yes.
really care about your workers, right? The trade, it could be pipe fitters, electricians, doesn't matter to me. But if you really cared about those that are getting the job done, then this is just one way to, let's say, provide them with a better benefit, a much better benefit than you can even negotiate. We've already established that. And so I'm very cynical when it comes to like these people over here
Hmm.
because they talk about it, right? They'll give it lip service, but in reality, you're just a number at that point. And
Yeah.
that's what I think. You're not. They're so used to people knocking on the door wanting a job, as opposed to, well, now you have to go out and recruit slash retain people. And so and to be fair, right? Um, I'm very much in favor of the way, like all of the various things that our leadership, whether iron workers, pipe fitters, it doesn't really matter. The way that we're, let's say, completely looking at like a larger, big picture of, at the end of the day, how do I bring more value to the membership?
Yeah.
How do I
Yeah.
bring more value to the membership? This right here, what you and I are talking about, is, in my estimation, one of the most significant things that I have seen that is born out of outside the box thinking. And I think it's fascinating because you'll hear people all the time. It doesn't have to be about medical at all. It could be about anything at all. And they go, well, that's just not how it's done. That's not how it's done until that's how it's done. Until somebody thinks outside the box and says, no, 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 we can do this a different way. We can do it this way. We can do it this way. Why? Why are we, constraining ourselves in this antiquated rhetorical thinking? They used to say the same thing about that's not how it's done before people wanted a weekend. They used to say the same thing about child
Exactly.
labor. They used to say the same thing about 8-hour work days. I
Yeah.
mean, all of that stuff. And so I'm very bullish, and I think it's outside the box. And to all of the individuals who are sitting on the board and thinking and continually like, how do we make this better? How do we provide, how do we keep our costs down, right? How do we bring more value to the member? There's so many different things, and it just really, I think, paints the picture of where unions are, let's say, miles ahead of corporations and big
Yes.
business and all this stuff, and they talk about value in people. The rubber meets the road, where the proof is in the pudding, right? where
Yes.
where are we demonstrating that we value individuals? And I think that this model right here is a phenomenal thing that they're doing. So
Yeah, thank you. It really is. I mean, to quote Vinny Alou, I've used his quote so I can use his name. He said this is going to, he's the business manager for Laborers Local 66 on Long Island. And he said this is going to be a revolution in healthcare for the trades. And then hopefully for the country, because people will realize just like labor leads the way for the middle
yeah,
class, we can lead the way to bring better healthcare to the entire country, right?
yeah,
And remodel the way things go. But like you just said, it's labor leading the way. And I was just in another podcast and I was talking about, my family, right? Everybody's in a trade. Okay. So us older women in the family, right? It wasn't an option when we were younger. So we just grew up in it and around it. And, but, everybody's husbands and grandfathers and uncles and everyone, iron workers, police, fire, steam fitters, electricians, all different kinds of trades, right? Everybody's in elevator constructors. Everybody's in a trade. My grandfather was sanitation. I didn't know any other thing, right? So until I got older and started to do the work in the trades and, realize what was going on around me, I didn't realize what an opportunity we are all given and that our families are given to be in the union world, right? And to have that option of being able to come out of apprentice school with a full career and a pension and all of those things. And
Yeah.
I think a lot of it was the way things were and the way a lot of people got into the trades, right? So times were very difficult, right? It was a lot of Italians, a lot of Irish, all of those things, right? So there wasn't a lot of opportunity, and they built this opportunity, right?
Yeah.
They like for us, it wasn't an opportunity for me to become an iron worker, right? It wasn't their opportunity to even think about going to college or becoming a doctor or any of those things. And now people are back to realizing what an opportunity it is to be a
Yeah.
tradesperson. And schools are coming back to that reality as people are dealing with hundreds of thousands of dollars in loans and, all of those things rather than your kid actually getting paid to go to school, right? And learn a trade and do all of those things. So if we can take that movement and move it into the healthcare space like we're working on doing now with the building trades as a partner, I mean, I can't think of a better partner. I know I'm a little skewed, but I can't
Yeah.
think of a better partner than the building trades, right?
Yeah. Well, I can't imagine there's an insurance company out there that is actively looking to provide increased medical care. And they may say that, but what they're really looking for is, also how do I increase the maximum amount of return, when it comes to the bottom dollar. And
Absolutely.
that's where I think that this whole model not only is shining as we're currently talking about it, but is poised to shine even more, especially when it's like, nah, we're not allowing you to buy in unless you're, labor. Because I don't
Aligned.
want any conflicting issues. I don't want any, this back and forth, this sandpaper aggressive. No, this is the mission, is to provide the best model of healthcare. It's not necessarily to squeeze every ounce out, squeezing blood from a turnip, if you will, right? We
Yes.
want to provide good quality health care and to give more back to the membership. And I'm grateful because what I think is probably going to happen is that if you hear anything about this model, it won't be from big corporations. It won't be from uh, it's not going to be from, anti-union advocacy groups or anything like that. It's all going to be from, grassroots and podcasts and things
Yeah.
like this, because this doesn't serve their narrative. This doesn't fit their
No.
narrative. This. What do you mean you're coming up with great quality healthcare like this? We can't have that because that takes away our narrative and our talking points. And now we can't have that. So, I'm grateful that you took the time to come on the podcast, because I've been interested for a while now to talk. I think it's a fantastic model, and I think that it'll be interesting to me to see, because you said Oklahoma is what I heard you say.
We have Spirit Aerosystems, which is now actually Boeing. I keep saying Spirit, but Boeing took them over. So they were our first customer out in Oklahoma. They have just renewed their contract after 7 years because they are still seeing double-digit decreases in their overall healthcare spend and
Really?
a healthier population. Double-digit decreases net
Yeah.
after Solidaritus cost, right? So,
Wow.
yeah, I mean, 7 years. We've just opened up another center in Oconomowoc, Wisconsin, right? So another, like you said, that's like I mean, it's probably where it sounds like, right? It's kind of in the middle of nowhere, right? It was very
Right.
cold, all of those things for a teachers union. We have the UFCW in California. We have centers there. We're expanding there to the Northern California building trades to include the Northern California building trades. So we're doing a lot of work as far as the building trades goes. But then, of course, there's also
Right.
um,
Right.
public sector that we're serving as well.
Yeah, it's fantastic. And so if you're doing it to that degree with the teachers, UFCW, it's what it sounds like to me is that uh, cost is not as big. It's not this big gigantic hurdle that a lot of people are trying to make it would probably say it is, or try to make it out to be, or whatever. It's like, well, let's have a conversation about the local building trades, or the local whatever group we're happen to be organized and representing, and go, let's take a look at what you're spending, how much money you're bringing in, etc., and let's talk about how we can greater benefit what you've got going on.
Well, and historically, from the beginning of Solidaritus, right? So we have 9 years of data now. I The lowest first year savings, right? So that's when they started paying Solidaritus, and 12 months out from there, there's still, I think the lowest was a 4% decrease in their overall spend. But if you're talking about, like, we just did an analysis for a local here in New York, and their spend is almost 300 million. So if you're talking about 4% of
It's
300 million,
it's
you're
a
talking
significant
about
amount of
some
money.
money,
Yeah,
right?
yeah,
And then that, has historically increased to up to 31% on the overall healthcare spend 5 years out. Now, there's a lot that goes into that, right? Maybe they made some plan design changes. Maybe they increased co-pays to go outside of the Solidaritus primary care, right? We've made contracts with surgery centers, with imaging centers, with all of those things for, a quicker payment, but a high value, uh, you know, give us a high value wrap. Give us from soup to nuts and we'll pay you right away. But you have to charge us 50% of what the insurance would pay you, all those kind of things. But what does that mean, right? What is that? That's collective bargaining.
bargaining.
We
That's
have
right.
these rights, we
That's
have
right.
these amount of lives, we're going to get them all together and we're going to bargain with you.
That's
I
right.
mean, it's actually what you guys do,
Yeah,
right?
look. It's just taking collective bargaining to the next level,
Yes.
and number one, it's bringing more value to the member, but I, I'm I'm really interested in seeing how, let's say, what do you think? Let me ask the question this way: Do you do you have a thought on how on cost difference between, let's say, what a non-union contractor is paying in insurance as opposed to this right here? And here's what I'm getting at, because we brought up the possibility of an organizing tool earlier, right? So to me, if you're talking to the contractor that is just, they have an axe to grind for whatever, like they've bit down hard on the narrative, and you're not going to reach that individual. But for the one that's spending money to provide healthcare, I know there's a lot of variables here, but for the one that's providing healthcare, do you see? Um, I don't really know the difference between a lot of non-union, the average non-union contractor, and how much money they spend on insurance, as opposed to what unions do. Um, do you have any data at all on whether it would be an increase in non-union contractors having to spend more money to, let's say, join the portfolio, even if they were intentional about taking care of their employees, or are is there data to say they're spending the money, they're just not getting the value that they should?
Well, I mean, if they're not engaged in any kind of cost savings like this, absolutely. I
Mm,
I don't know. I do know that we wouldn't allow a non-union contractor to become part of Solidaritus unless they became signatory.
that's what I'm getting at. That's what I'm getting at.
Oh, no. They can't. They would have to be signatory to a union.
That's what I mean, though. Is that
Oh,
one of the?
it
That's what
would
I'm
save
getting at.
them so much money,
That's
right?
what I mean.
So, yeah, depending on how much of the contribution they make, right? So, when you're in a trustee meeting for people who don't know, right? You have the employer side of the table and then you have the union side of the table, and the employers are part of that contribution and the union has to give up some of their dollars in the pocket, right? So that's that combination of people. It would still save, no matter who the payer is, it would
Yeah.
still save that percentage on their overall healthcare spend.
Right. So if let's do a hypothetical then, because this is where my mind was going. Let's
Okay.
say that I go and I talk to, because there's two different ways to organize, right? I can get the employees to come together and to vote for an election, or because you got nine A, eight F, or what I could do is I could talk to the business owner who is smart, business savvy, and can see a deal. And let's say he wants it he adequate. Let's say he does indeed take care of his employees. I'm like, listen, um, I know we've kind of been on the fringe about we've kind of talked a little bit about this, a little bit about that, the benefits that you get, et cetera. Here's an additional benefit. By the way, how much money are you spending on your healthcare? Oh, let me tell you about what we've got going on over here. This is what this is. This is how much money we're spending. This is this. This is that. And they're like, wow, wait a minute. This is the value you're bringing to the members, to my employees, and even what we were just talking about, which is the potential for the management side to also get this benefit. I see that as a significant opportunity to present to, like I said, you're not going to get the anti-union individuals that are just, I mean, they just seem to be born with an axe to grind.
Mm-hmm.
But the ones who just don't know, and that's where I
Yeah.
think a large portion of people, they just don't know. And if you present this, I see it as an opportunity to grow contractors, to grow members, to grow market share. I just see I think that the business manager, it was the laborers, right? Local
Mm-hmm.
66.
Local 66, yeah.
Yeah,
Vinny Lou.
very. Yeah, so revolutionary, I believe, is the word he was
Yeah.
using. That I think is an accurate description. I think that if used properly, not only do you bring value to the members, but you're also bringing more people into the fold. And guess what? That's what we want. I just want to collectively bargain for more people because I'm
More
bringing
people.
more value to all of the individuals that I'm bringing in here, right? And I'm encouraged by what I heard you say earlier, which is that management is even like, what you got going on here? This might benefit my people. You're right.
Yes.
You're right.
Right. And so, only thing I can speak to directly about that, and I can't say the contractor's name and I can't say the local's name because it's still kind of in the works. So I can't bring all that out yet. But it's a major contractor. And if I said the name, you would know. Almost anybody in the country would know. Okay. And this one local, um, because this owner is realizing that the benefits that the members have are better than the benefits his employees have. That's why they're thinking about bringing that in and doing the participation agreement. So I could see this being an organizing tool and bringing more contractors into the union world. And like you said, of course, they would have to be on the fence. Um, maybe the employees are pushing from that side of things, but I could see this absolutely, being a tool to bring those on the fence to just to the right side of the fence,
Yeah. Well,
to where the
so
grass is definitely greener.
definitely greener, right? That's where I'm at, right? I think that, and here's the other thing about this is that it is a all right. So when we sit here and look, I talk about this all the time. When we sit and talk about the labor shortage. You can sit here and talk about there's an age gap in our industry. 100%. It's just what it
Yeah.
is. I talk to the apprentices and I'm like, you guys are seeing 30 and younger and 50 and older on the job sites. And they're like, yep, yep, yep. And I'm like, people like me, mid 40s, are a rarity. I've been doing this for long enough now. I've been doing it for 24 years, but I'm like, listen, I get it. So, in the interest and intent of recruiting and retaining employees, better health care through this, and then you go to the contractors, you're like, Are you tired of surviving, and you want to get to where you could be thriving? How about additional benefits in the recruitment slash retention? How about the fact that you should bring apprentices on and be intentional about mentoring and developing them? Oh, by the way, those same apprentices 10 years from now are going to be your key employees. You want to take care of them? Let's talk about what we can do as far as benefits, as far as healthcare, increased, increased intentional healthcare with the model that we got. I just see so many possibilities. I really
Yeah.
do. I think there's fantastic.
Yeah. Thank you.
Yeah. Yeah.
I'm happy we finally got to do this
Yeah.
between both of our schedules.
Yeah.
Um, it's
Yeah.
been a lot, but I'm
It's
really
been a lot of
grateful.
fun. And I just
Yeah.
think that, there's just so much information out there that a lot of people just don't know is out there. They don't,
Yeah.
I had a good friend of mine who used to say, you don't know what you don't know.
Yes.
And he's 100% right. You don't know what you don't know. And there's so much information out there from the members perspective, from, individuals who are part of the building trades and the construction industry as a total, as well as contractors. They just don't know what they don't know.
Right.
And um, I- sometimes I feel, Mark Twain said that it was easier to fool a man than it was to convince him he's been fooled. And that's that uphill battle of trying to, go, listen, this propaganda about what a union is and what it isn't has been so effective. And I'm trying to tell you that it's so much better than what you think it is. It really is. This is one of
So
those
much better.
things. This is one of those things that has the potential to really open eyes if, case studies and podcasts and, quite frankly, even documentary series and things are used to like peel the veil back and say, let's talk about what this really boils down to. We're
Yeah.
trying to bring the best value we can to members. It's just a group of people that are coming together to collectively bargain. In this case, they're collectively bargaining with for better healthcare.
Yeah.
Better healthcare.
And even I just want to make it like this narrow, right? The narrative right now that's coming out of Washington is about only talking about this, right? Better healthcare, better
Yeah.
costs. I'm not trying to get into controversy, right? Better healthcare, better costs, healthier Americans, healthier people, better mental health and wellness care, all of those things that are coming out right now. So, against the narrative that has been there prior,
Yeah.
right? Against
Yeah.
that massive machine.
That's right.
We're making progress. So if now labor gets behind this and makes this an entire movement, healthier people.
Tremendous pop. The idea that I'm not going to go to an ER. First of all, I'm going to continually go to my PCP, but then I'm going to not go to an ER because it doesn't enter my mind because I have access to a medical doctor who isn't inundated with patients. And then he goes, all right, listen up. I've taken the time to look over your charts. We look over your blood work, this and that, whatever. Um, I could give you a semi-glutide, which is Ozempic, but you know what you ought to do? Go out there and get physical. Go out and walk 10,000 steps a day. Uh, Try this for a month or two. Let's see what you do. Let's see what happens. Come back to talk to me in 3 months. You go back and talk to him in 3 months. And he goes, man, you done lost 15 pounds. Look at that. Feeling better? You get energy? Yeah, let's work on this. You take that and just kind of multiply that throughout, your customer base, the people that you're providing healthcare for, which happen to be union members, and you go, well, look at that. They've lost all this weight. They've reduced their, overall cost from healthcare coverage and how much money they're spending. They're taking less and less medication. They're getting outside. They're becoming more. And we go, all it really boiled down to was let's say, outside the box thinking, but then someone going, these are seemingly old things. Like, let's just get to know one another. Let me see what you got going on. Oh, I thought I told you. Have you been taking your steps? You taking your steps? No. What did I tell you? Didn't I tell you you got to be out there and active? You're not going to make any significant. Whereas, the previous doctors goes, here's your prescription. Get out of my face. Get on down the road. Like
Exactly.
you know what I mean? So
Exactly. And you know that you brought that up, like here's a pill. I think almost more than the hospital systems and the insurance companies, pharma's not going to love this.
yeah, I think you're right. But
Pharma's
going
not
back,
going to love this. And the funds are getting, killed by all the Ozempics, and I mean, that's one of the major questions when I'm doing a trustee presentation and I talk about the drugs that we can supply at wholesale through Solidaritus. I mean, that's one of the biggest questions right now. It's not even so much more the catastrophic costs, like God forbid someone has MS and they need infusions or cancer. It's the little stuff. And back when I was doing members assistance, and if I got any pushback about, well, I don't really think we have a problem. I don't think we have a problem. I don't think we have a problem. I go, why don't you look at your prescriptions and see how much Suboxone's being prescribed?
Yeah.
Go look and
And then
and
come back.
and then come back to me and tell me that you don't have a problem. And they're like, how
And
did you know?
yeah, because it's like an epidemic almost. And you're absolutely right.
Yeah.
All right. So, last question.
Okay.
That I can think of that our conversation may turn into it.
Yeah,
All right.
we can do this again.
I think it's
This has been
fantastic.
fun. I'm always so nervous. I mean, but anyway, you made it very easy and comfortable.
Oh, I love this stuff. The doctors that you have, or medical professionals, the
Hmm.
medical professionals that reach out to you, um, what's their feedback after 6 months to a year? This is
Oh,
amazing.
they're so happy. They're so happy. Like when you meet our medical director, his name is Dr. Mark Liu, and he's the Navy veteran. I mean, he's like the only way to like he's such a chill guy. Like you wouldn't think he's the medical director of a company, He's just, "Hey, how are you?" Like if you were just kind of standing in the center, you wouldn't know that's the medical director for Solidaritus. Like he's just a happy man, and he's satisfied with what he's doing is making a difference. And so he wants the other doctors to be doing that as well. We have a pretty high retention level. I mean, other than like someone needs to move or something like that, our doctors tend to stay, which is one of the major questions when we're doing a trustee meeting. Is that's what the trustees ask, like, how happy are your doctors? I know you're talking
Yeah.
about building relationships with people, but it's going to be hard to do if a doctor leaves every year, right? Or something like that. So that's our goal, is to have happy doctors, happy medical professionals. Our model is physician led. That's not saying that we wouldn't add as the so in the centers traditionally, we've had a maximum of 4,000 patients for but it's generally 1,000 per doctor. Some of the funds have talked about, like, hey, you know what, maybe we want to add in a nurse practitioner in between, like maybe we get to like 900, and we're not really ready for another full doctor, right? Because that's our major cost, are the medical professionals, right? Once the construction's paid for. So maybe we want to add a nurse practitioner, maybe we want a medical assistant, those kind of things. But we are physician led, so we want them to be happy and we want them to stay, and we want them to, in 20 years say, hey, I remember when you were born, like that kind of stuff. So
No, I'm just, oh, I'm so grateful that you took the time to come on, because my mind had been toiling the questions over and over again. Like, how does this work? I think it's everything that I think it's going to be. And quite frankly, it's probably a lot more than that. There's so much, positivity, so many benefits. I think that there's so many ways. And again, it's, it's my distaste of, well, this is how we've always done it. I don't want to hear that. What I want to hear is, that's what everybody says until they did it a different way. And this is a
yeah,
different way.
yeah,
It's
it
thinking
is.
outside the box. It's bringing more value. There's so many, long term ramifications to this. I just think that there's a significant benefit that this is going to play a part down the line. I'm blown away. I think it's fantastic. So
Thank you, thank
yeah.
you. Well, I'll have to get with you regularly to keep you updated on the progress.
Yeah, well, look, I'll tell you, I'll anytime you want to come on and have a conversation about expanding into an area,
Yeah.
or hey, we were looking to do this or that or whatever, something that can give let's say 45 minutes to an hour, we can sit and talk about whatever kind of tweaking, just keep me in mind. I'll definitely have you back on. I think we had a good engaging conversation. Hopefully people listen, they like it, they share it out. Maybe they've got some additional questions that they'd like to have answered, because
Sure.
I think that, and then certainly on your end, you can push it out too. Say, hey, look, here we are having an open, honest conversation about what I'll say is probably going to be called the future of healthcare, especially, from a union perspective.
Yeah. Awesome. I love it.
Yeah.
Yeah.
So, Mary, thank you for your time, and I
Thank
really
you.
appreciate you coming on.
Thank you so much, and safe travels tonight. Say hi to
Thank
all
you
the
so much.
apprentices. Tell them to try yoga. I want to hear that feedback.
I will send you a message and tell you. I'm going to say, look, I was asked to tell you guys to try yoga, and let me see some of your responses, and I'm gonna let you know what they are.
And then you know what, on the back end of it, really check their benefits. They may have benefits in their package that they don't even know about for physical therapy and therapeutic massage and all of those things. So could be available to them.
So we have really ridiculously low, let's say copay, not even copay, deductible. We have a really ridiculously low deductible, and again, it goes back to what you were saying earlier, which is union negotiated healthcare.
Right.
There's and now we're just taking that what we've got 10 steps further, and going forward. I think it's fantastic. So
yeah. Good. Well, I'm anxious to hear.
Yeah. I'll shoot you a message and I'll let you know when the podcast episode is pushed out.
Okay.
It will probably be, when is the 16th? That's not next week, is it? That's the following week.
Following week.
Yeah. So it was not, so this was probably going to go, I'll probably edit this and put it out next week.
Okay.
And then, because the following week after that, I've got a podcast dropping with an Australian psychiatrist, one of the two. Anyway,
all right.
So I'll let you know when it drops. I'll tell you, hey, look, I'm going to drop this in the next couple of days or whatever, and then we'll go from there.
Great. And you know what? If you look on the International Ironworkers Instagram, they put a little thing of me up yesterday. I think, I don't know if it's still up there, but from the podcast that my friend at Union Labor Advisory Network did the other day. So they sent it to me. They're like, hey, the International put this up of you. And I was like, no way. So
that's awesome.
Yeah.
That's awesome.
But you know what? Jimmy Mahoney worked with my cousin in 580, and he's now the general secretary.
Yeah. When so
Eric Dean just retired. Yeah.
Just retired. So when you said 580, that's who I thought about, because I knew that's where he's from.
So I'm guessing that he must have grabbed it, because we're all from the same neighborhood, so I know. Oh, Jimmy must have done that. So it was cute though. I was like, I could feel my dad looking down, I was like, hey, Dad, look, the International put me up on Instagram.
Yeah. Hey, you know what? I mean, so social media is a bear. There's a big part of me that doesn't like to take long form conversation and chop it into small pieces. But when in Rome, so I get it, right? So
yeah. Well, I get that, and really, what it wasn't even so much about Solidaritus. It was me talking about, hey, my dad was I'll text it to you, but my dad was a 580 iron worker, and the opportunities, and so it was kind of more a female talking about the opportunities, in labor. So it was good.
Yeah, I'd like to see it. So, all right. Yes, thank you, Mary. I appreciate your time.